Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you know, this is a webinar where we're going to talk about Lyme disease. I look forward to seeing what you all have in store for me tonight. None of these webinars is ever the same because you create them with your questions. I am visiting with you from my new home in Austin, Texas tonight, and I got an interesting backdrop, as you can see there. It's a wallpaper that has images of animals on it. So yes, those are various kinds of animals dressed up like humans. So I'm going to be here in Austin a couple weeks each month while I transition out of my clinical practice. I think many of you know that I'm stopping my clinical practice. And so after May, I'll be down here full time. So anyhow, that's where I am right now. That's why it looks like a different setting there. I want to assure everyone that when I stop seeing patients clinically, I am still doing my webinars. I'm still going to be writing about Lyme disease. I'm still going to be educating people as much as I can to get help with this illness. And the other thing I'll be taking on, I'll keep my store going as well too, but I'll be setting up two new communities, one for people living with Lyme and another one for healthcare providers that need some support as they endeavor into treating Lyme disease too. I want to try to help more practitioners get comfortable doing this. And I feel I can do more to help the Lyme community by leading some of these communities rather than just doing one-on-one work with my patients. So although I'm retiring from clinical practice, I am not retiring. I am going to keep helping you all in all the ways that I possibly can. So you'll see me here. Anyhow, I'm interested to see what y'all think about my animal pictures back there, but we'll see. I may even get a different backdrop here over time, but that's what I got for tonight here. So for those of you that are coming back, I see that I have a number of familiar names on my message board. I'm glad to see that you're here, and I'm glad to see that you keep getting some value out of this as well too. For those of you that are new, welcome. It's good for you to be here. I'm glad to have you here, that is. The way you participate are two ways. Number one, I will take questions, and the way that those are done, there's a chat box on the bottom of your computer on the right-hand side. You could write a question to me. You could be very bold on your first time here and write a question. That's one way to participate. The second way is to listen to the questions. I will read them out loud and then see what responses I give. There's always some good education and some ideas that you may get by listening to some of those responses as well too. I do want to let you know, I will not get through every question tonight. I do a good job of trying to get through as many as I can, but I try to explain things too. And sometimes maybe I get a little bit long-winded with those explanations, but generally I'm trying to explain things. So just bear with me if I don't get to your questions. I don't try to avoid any questions. And in fact, basically I take questions, post them up, and then I really read the content. Sometimes I scan them just a little bit beforehand, but I don't filter out anything. So just wanted you to be aware of that as well too. I am creating a recording of tonight's webinar, and that should be available for you tomorrow morning. I will try to have it out. Actually, I'll be probably working on getting it all completed tonight. As I start my drive early tomorrow morning back up to Austin with the Seattle, that is, with the two Basinji co-pilots that I have and in my camper van. So I'm going to try to get that all wrapped up tonight, but the email will come out to you tomorrow morning. And that will have a summary of the things that we talked about, as well as a link to the video and a link to sign up for next week's webinar as well too. So this is the beginning of 3 webinars. We'll be here with you tonight and the next 2 Wednesday nights as well too. So without any further ado, let's go ahead and get started here. All right, so first question. Hello, S. Let's see. Hi, Dr. Ross. Thank you for always being so very helpful. I'm 3 months into fluconazole-based Bartonella and Lyme treatment. Suddenly, I'm starting to experience signs of Babesia, such as night sweats, night terrors, difficulty breathing during the day. Is it possible that Babesia gets worse during Lyme Bartonella treatment? I don't have these symptoms prior to treatment. What would be the best thing to do in a situation like this? I was thinking of adding cryptolepis for Babesia or would it be better to finish the Bartonella and Lyme treatment first, or to stop treatment and treat Babesia first? Thank you so much. So first of all, I hope you're working with a healthcare provider, because I'm going to give you some ideas, but ultimately you need to talk to a healthcare provider to get the best idea for you, okay? I would need to help tease out whether this is Babesia that's happening or that your Bartonella treatment isn't working. I would need to ask you a number of questions about different symptoms and what symptoms led you to believe you have Bartonella, and then also look at these symptoms that might suggest Babesia as well too. So the Babesia symptoms that make you wonder about Babesia here is that you're having night sweats and air hunger. And the night tears. Now, I just want to say something, though. There's an overlap. Night tears sometimes can be part of Bartonella. And air hunger can also sometimes be part of Bartonella as well, too. So symptoms that make you think of Babesia are night sweats, okay? But also air hunger is part of that. A lot of neuropsych symptoms like having depression and anxiety, pervasive anxiety that's always there, for instance. Having neurologic symptoms of severe cognition impairment, for instance, sometimes is part of it. Sometimes having neuropathies where you lose feeling in an area, or you can't use a finger or a leg, or you're weak in those areas, for instance, or you have tremors or shakes. A symptom that really, I'm sorry, I think I just went off on a tangent there. Let's go back. Babesia symptoms are night sweats, air hunger, sometimes frontal headaches, having panic attacks, which usually more daytime, not nighttime panic attacks, having skipping or racing of the heart, and having episodes where you get lightheaded easily on standing. Okay, those are more Babesia symptoms. Okay, Bartonella symptoms, and I'm sorry I was confusing you all there for a minute. Bartonella symptoms are having a lot of neuropsych issues, having a lot of neurologic issues, severe cognition, severe thinking can sometimes be part of Bartonella. Having pain on the soles of the feet can sometimes be part of Bartonella. Air hunger can be part of Bartonella. And having sometimes day sweating as opposed to night sweating, sometimes that can be part of Bartonella too, okay? Now I gotta admit, sometimes these things overlap a little bit. It's not always clear, but I can't tell for sure by what you're telling me whether it is that your Babesia treatment, your Bartonella treatment is not working. That could explain night tears. That could explain some of the air hunger. Or do you have enough other symptoms that make me wonder if there's Babesia? Okay. So I think you need to look at that. And the best way to look at that, I think, is with a healthcare provider, if you can find somebody to look at that with you. If in the end this is Babesia, what I would do with a patient of mine that had a similar thing happen is I'd probably still keep treating the Bartonella as you're doing, and then I would add a Babesia treatment to that. As long as you've been on a Bartonella treatment for some time already, I would add a Babesia treatment to it. Cryptolepis is an option you could use herbally. The advantage of cryptolepis also is it probably helps treat growing Lyme and persister Lyme. And also cryptolepis has got some lab evidence that it can help with growing Bartonella and persister Bartonella as well too, okay? Other options, if you don't go with cryptolepis, would be your provider to this regimen. Well, I don't know what else you're on with your fluconazole. If you're on a doxycycline, a minocycline, a clarithromycin, or an azithromycin, you could easily add a Malaram prescription medication to one of those along with fluconazole and Malaram. That would be a Babesia treatment as well too. But again, I think you need to sort out whether this really is Babesia or not. And that would take looking at a lot of questions I had. And sometimes it's just helpful to have a provider do that with you. Okay. All right. So good luck to you. And thanks for that question. Oh, one thing I just want to mention here. So I mentioned that word persisters. Okay, so let me just briefly mention it. Many of you are familiar with this, but in the world of Lyme and in Bartonella, one of the things we're realizing is that there's a percentage of the germs that come out of a growing state and go into a hibernating state. And in that hibernation state, it's hard to get antibiotics to work on them. So there's been a little bit of research going on over the last 4 or 5 years now that we realized this, looking at agents that we can use to treat for persisters that fluconazole-based treatment that I had you on, interestingly enough, fluconazole we usually think of as being a yeast medication. There was some research out of Johns Hopkins about 4 or 5 years ago now that showed that azoles, that family that fluconazole is in, might be helpful against persister, Bartonella, and growing Bartonella. And so that's why I'm recommending that as a way to go after Bartonella these days as well too. Okay. For those of you that are a little bit new to the idea of various kinds of ways that I build Bartonella treatments, let me just do a quick screen share here for you. And I think I got my screen share thing. I was having an issue with my screen shares, but I think they're supposed to be working out. And by golly, it looks like it is going to work out. Anyhow, let me get the screen large here. No, that's small. Why is that not showing big? Hold on here a minute. On my on my computer, this is showing small. How do I get it so it goes large here? Hold on. Let's see. There we go. Oh, okay, that works out good. Woo! Okay, that's the first time I've done it this way. So anyhow, that works. Okay, so this is my supplement store, everyone. Just happens to be landing here. And this is, if you're during the webinar to now make a recommendation, number of supplements. If you're looking for a source, feel free to get them here. You don't have to buy anything from me, but this is a place you can get them. And anyone can buy from here, but this is where my patients get their supplements, and this is where you can get your supplements. The advantage from buying from me is I don't charge you any state and local taxes, and they do free shipping if you qualify with orders of $50 or more. Okay. And I appreciate your business if you do that too. Anyhow, I was trying to get over here to my information site. And so this is the main area of my information site, this place called Online Lyme Guide. And in this section called Infection Treatment Plans, you could look down here to the article I have called Kills Bartonella, a Brief Guide. And within here, I describe, about Bartonella persisters, different steps that you want to take to treat. And then I break my treatments into 3 different groups. There's what are called tier 1 treatments. There's a tier 2, but the tier 1 I break into various ones. There's what are called fluconazole-based treatments. That's the diflucan. And then you build it with some other things. There's rifamycin-based treatments. And then there are what I call macrolide tetracycline-based treatments. And I list out how do you build these things, okay? So they're all there basically. And the tier 2 approaches would be your herbal approaches. And I even talk about cryptolepis in here as well too. But if you want to look at this more later, this is the article you could take a look at. One other option, any of these treatment plans that I talk about, you could also find in my new book. It's called Hacking Lyme Disease. This has got a number of sections in it, of which one section is all of my treatment plans for the different infections. I also review key factors that determine whether somebody's going to get well or not. I review things that keep you from getting well. I review in here major alternative treatments like ozone treatments or SOT treatments, and I give you my take on them, whether I think they're going to be effective or not. I have key articles in here about things like low-dose naltrexone, peptide therapies. Anyhow, it's a pretty comprehensive book, and a large part, and what it is based on the writings that are here on this website. But if you're looking for a book you can carry around as opposed to flipping over to the website to look at it, this is another thing that you could wind up doing too. Okay? All right. So let me go back here. All right. Okay, so good to be back here again. All right, so let's go and take the next question. Hello, Dave. Let's see here. Hi, Dr. Ross. Thank you for being so great. You're welcome. Let's see. You mentioned that most symptoms are caused by excessive cytokines. With that said, I was wondering what absolutely life-crippling fatigue is more likely to be, Babesia or Bartonella. I tested positive for Lyme. by IGeneX and have clinically diagnosed Bartonella. However, I was wondering what the extreme fatigue means. It seems like nothing makes a dent, so I don't know if I might have Babesia. I know usually other symptoms might give it away, but fatigue is basically my only yet very severe symptom. Thank you. All right. So of of the three major germs, okay, so granted there are more than just Lyme, which is Borrelia, Babesia, and Bartonella. That when you get bit by tick, you can get some other things like anaplasma or leachia, for instance. Maybe viruses get transmitted too. Mycoplasma might get transmitted. But the big three, the three that give most people most of their problems are Borrelia, which is Lyme, Babesia, and Bartonella. And of the three, in my experience and working with this illness, Babesia probably tends to be the most fatiguing. Okay. Now, that being said, there are many things that lead to fatigue. Okay. But of those three germs, Babesia tends to be the most fatiguing. Okay. Now, when it comes to fatigue, there's a number of things that can add together to give you fatigue. Number one, poor sleep. So it's good to get 7 to 9 hours of sleep to restore your immune system. And also it can help with your energy as well too. And during treatment, if you got to use herbs or drugs to get your 7 to 9 hours of sleep, get your 7 to 9 hours of sleep. Okay. The second thing that can interfere with your energy is low adrenal gland and thyroid function. And so in my treatment protocol, I'll show you in a minute, I have a section on determining whether you have low thyroid or low adrenals. And I don't talk just about the lab test saying that you're low. You can have clinical low thyroid and clinical low adrenals. So one of the basic things I like to put everyone in my practice on that has a form of fatigue is an adaptogen herbal medicine called ashwagandha. Ashwagandha comes to us out of Chinese and Ayurvedic medicine. It's been used for thousands of years in those cultures because it's been observed to give people better energy under stressful situations. And the way I like to dose that is 400 to 500 milligrams pills. Take 2 pills in the morning and 2 pills between 1 and 2. And that sometimes can help too. Okay, so get sleep, correct, do herbal supports for your adrenals and thyroid. Third thing that can make a difference is lowering cytokines. So Dave mentioned cytokines. I think many of you who participate in webinars know about cytokines, but for those that are new, I'll just do a brief explanation. If you get an infection in you, or if you get mold toxins in you, or if you get too many yeast in your intestines, the immune system is going to respond and try to deal with that infection by making some of the white blood cells are going to make a group of chemicals called cytokines. Okay. Now, cytokines are good and bad. All right. On the good side, they turn the immune system on to better deal with these problems. On the downside, if the immune system is not doing a good job, it's going to try harder and harder. And eventually it's going to make too many cytokines. Okay. And too many cytokines give you brain fog, disturb your sleep, make you feel tired, give you fatigue, make it so you can't think, interfere with how your adrenals and thyroid work. Anyhow, cytokines are the kind of the foundation of why people don't do well. Okay, so if you have fatigue, get sleep, support your thyroid and adrenals, lower cytokines. Okay, treat your infections. All right. Now, the other thing that can happen. So not all causes of fatigue are due to Babesia. I want to be clear about that. You can have bad fatigue and not have Babesia. All right. And rarely do I find somebody that has bad fatigue is the only symptom suggesting Babesia. Usually there's the other symptoms that I talked about earlier tonight. All right. So other things that can give ongoing fatigue would be if you have mold toxicity illness. And remember, I just mentioned that mold toxicity, if you're one of those people that captures mold toxins and can't get rid of them, that triggers cytokines as well too. Okay. So that's something to keep in mind. But the other thing that I like to do in my practice is if I'm about 5 to 6 months into a treatment with somebody and getting sleep, treating infections, lowering cytokines with curcumin, and then being on ashwagandha, if that doesn't make enough of a difference in energy, then I'm going to start thinking about doing what's known as mitochondria support and mitochondria repair. So let's talk about that real quickly. Mitochondria are your power factories. And by some estimates, we have 300 to 400 mitochondria in a cell. There's a lot of mitochondria there, right? And what happens inside mitochondria is sugar and fat are burned through a bunch of chemical reactions to create a type of cell fuel, which is called ATP. Okay. And what needs to happen for that process to happen, you need a healthy covering on your mitochondria. That healthy covering allows fat to be transported to the inside and sugar to be transported to the inside to be burned into cell fuel. And then secondly, that healthy fat membrane donates electrons into a bunch of the processes that create cell fuel as well too, okay? So that when you have chronic infection or you have chronic mold toxicity, the covering on your mitochondria can get injured. And that's because the immune system in dealing with these issues is going to over-manufacture a group of chemicals called oxidizing agents. So the immune system can make ozone, for instance, that it and hydrogen peroxide, that it will barf on germs and try to kill them. So you've got all those extra oxidizing agents, and they can damage your mitochondria membranes. So if I'm about 6 months into treatment, somebody's energy is not budging, and I'm pretty clear it's not from Babesia, I'm going to start doing some mitochondria repair work. And what I like to do, there's two foundational parts to that. Number one, I'd like to get people on a very strong antioxidant called glutathione. Glutathione, many of you may know about, it's manufactured in the liver and is one of our key detox chemicals, but it's also a very strong antioxidant that repairs damage to mitochondria and to cells from the inside, okay? So it does inside repair. And the product I like for that is a product manufactured by Research Nutritionals called Tri-Fortify. The reason I like their product is they've got studies that show it's very well absorbed. Glutathione is generally not well absorbed, but their studies prove you've got good absorption of this, all right? And I usually have people take of their Tri-Fortify a teaspoonful one time a day, okay? Then the second thing I'll do is I like doing what's called phospholipid repair, which is take something that repairs the covering of the mitochondria. I like using a product by Research Nutritionals called ATP 360. It is their mix of phospholipids along with some nutrients that help the mitochondria work better. You do 3 pills one time a day. Right. Now, the only time I will not use ATP 360 to do my mitochondria repair is if somebody is also on either Malarone, which has some atovaquone in it, pure atovaquone, which is also known as Mepron. So anything that has atovaquone in it, okay? And you use those for Babesia. So not all Babesia treatments are a problem, but those ones are. You don't want to have coenzyme Q10 when you're on an atovaquone because it limits the actions of the atovaquone, okay? And ATP 360 has some small amounts of coenzyme Q10. So if I've got somebody that's on atovaquone as part of their Babesia treatment, instead of using ATP 360, I use another product by Research Nutritionals called NT Factor Energy. And it is another type of phospholipid. You would start at 2 pills 3 times a day. Do that for a couple months. If it seems to be helping you, continue it for 4 more months. Same with the ATP 360, okay? Now, the NT-factor energy does not have coenzyme Q10 in it, okay? All right? So those are some things for you to think about, Dave. I'm going to do a quick screen share here again. All right, and all right, so let's see, in my information site, in terms of energy and low energy, take a look at my section here called Energy and Fatigue. And the first article here is this one, How to Fix Mitochondria and Get Energy in Lyme Disease. And I also describe what I call the basic steps, sleep, thyroid, adrenal management, et cetera, that I was talking with you about here too. Take a look at both of these articles. They'll give you some more insights, okay? All right. All right. Thanks for that question, Dave. Good luck to you. Hello, SJ, Dr. Marty. If someone in the late 30s has low urea nitrogen, BUN of 3 on a complete metabolic panel test, would you find it a cause for concern? What is the difference between ALT and AST in the liver enzymes? Is hydroxychloroquine powerful against Bart and Babesia? Why do some experts say zinc picolinate is dangerous form of zinc? Thank you. All right. So I'll kind of take these in some kind of order. Okay. So zinc picolinate, I'm not sure why some experts say it's bad. I haven't found it to be that. So I would need to see why they're saying that. Okay. In terms of the blood testing, blood urea nitrogen, urea, is a chemical that's cleaned out by the kidneys. And we get concerned if it becomes elevated. All right. But it's okay if it's low. There's no problem with it being low. In terms of ALT and AST, there are two enzymes that are made by your liver cells. And they become elevated if you have inflammation. I always forget which one. If you have inflammation caused by alcoholism, one of those can be more elevated than the other one relatively. But both of them can become elevated in Lyme as a result of a Lyme hepatitis caused by Lyme. Sometimes they're going to become elevated because of the medications that we give you as a side effect of those medications. And I expect that probably in some of the medications we use, like your azoles, your rifamycins, that you're going to get some degree of ALT and AST elevation. What I don't want to have is that it goes over 2 times the upper end of normal. So in ALT, many labs will report a normal range on it of being 20 to 40. I want to keep it below 80. Okay. I want to keep it below 2 times the upper end of normal. The upper end of normal is 40. I don't want to go over 80. The reason you want to keep it down is if you have ongoing inflammation of a high degree for too long, it might lead to liver scarring. And that could lead to something down the road called cirrhosis of the liver. Okay. That's bad liver scarring there. Okay. And then in terms of hydroxychloroquine, hydroxychloroquine is a quinine medicine that was originally used to treat malaria. All right. So you would think maybe it's going to be good against Babesia, because generally for malaria, we tend to use things that treat Babesia. Okay. But by itself, it doesn't really have any major effect and tends to be very weak when in treating Babesia. So I tend not to use it. Where I will use it sometimes is I will use it in a type of treatment called a primaquine based treatment. Primaquine and tafenoquine are of a family called the quinolones. In my Kills Babesia article, you'll see I have a section on quinolone based treatments. And Plaquenil can go nicely with something called primaquine to treat Babesia. The other reason that it can be used is Plaquenil helps alter acid levels within your cells, making your cells less acidic on the inside, which may help your macrolides, which are clarithromycin and azithromycin, and also the doxycycline and minocycline, work more effectively against Borrelia, the Lyme germ, and probably against Bartonella as well too. Okay. The other reason to use hydroxychloroquine is it can be a pretty good anti-inflammatory. And in fact, these days, the major people that write prescriptions for it would be rheumatologists. They use it as one of their big anti-inflammatories for rheumatology type issues as well too. Okay. All right. So I hope that gives you some useful information there. In terms of that Babesia that I just mentioned, in terms of the different ways to treat Babesia, let's do a quick screen share here. All right, so take a look at, if you want to see the other ways that I treat Babesia, take a look in my infection treatment plan section here, and then go down to the article called Kills Babesia, a Brief Guide. And in here, you will see basically the different tiers that I have. And one of those is atovaquone-based treatments, and a second one called quinoline-based treatments with primaquine, along with hydroxychloroquine is one of the quinoline type based treatments. Okay. All right. All right. All right. Very good. Good luck to you, SJ. Thanks for my question. Hello, Lynn. Let's see. Hi, Dr. Ross. I recently had slightly elevated MCH and MCV on a CBC. Are you aware of any relationship between these markers and mold, candida, or tick-borne infections? Any supplements that could cause this? I'm on BPC 157, glutathione, Mariva 500, BH4, and some pretty standard vitamins and probiotics. I'm also on gabapentin and low-dose naltrexone. Any other thoughts about the cause? So I am not aware of any of those supplements or prescription medications you're on increasing the MCV and the MCH, okay? MCV stands for mean corpuscular volume. It's the size of your red blood cells. How big are they? Okay. Things that can cause your MCV to become enlarged, metabolic causes, the most common causes are B12 and or folate deficiency. So if that's getting to be out of normal range, your provider might want to go ahead and check B12 and folate levels. Sometimes people just happen to have a high MCV and we don't find an underlying cause for it too. Okay. All right. And again, on each of these other drugs, I'm not aware that any of them would do that. I might need to, if you were to see me and you were having this problem, I probably would pull out my reference books and just make sure about that. Okay. All right. Talk with your provider, see if they have any insights in terms of your medications. Okay. All right. Good luck to you. Doug, your question didn't come through. It says, my question is, and then there's nothing that showed up. So I hope I find your question down the road here as I keep going through these. Hello, Linda. Thank you for taking my question. You're welcome. Do any of the tick infections cause hair loss? Do any of the treatments cause hair loss? All right. So when people have hair loss, there's some just general things we should do before thinking automatically it's related to our medications or to infections, okay? And your doctors probably have already done this. They should have checked your thyroid, and they should have checked to make sure you have high enough iron levels, especially by measuring something called ferritin, okay? All right. Now, if those are normal, the one infection I have seen lead to hair loss when it's active is Babesia. And in my patients that have had that as part of their Babesia, as we got Babesia under control, their hair loss stopped, okay? Another common thing that can sometimes lead to hair loss are in people with mold toxicity that are using charcoal. Activated charcoal, which can bind up the mold toxins in your intestines to help remove them from your body, also binds up some key minerals that are needed to make hair, all right? So if I've got somebody having hair loss on activated charcoal, I might think about stopping and go to other binders, or I might start thinking about having them on core minerals, okay? Beyond a supplement called core minerals, beyond that, I'm not aware of any of the medications that we use to treat Lyme and tick-borne illnesses leading to hair loss. I haven't seen that, okay? All right. Good luck to you, Linda. Hello, Karen. Let's see. Yep, that is Karen. I had to look through my readers there for a minute. See, I've been able to recover a patient from Lyme, Babesia, Bartonella, and mold using herbs alone. Also, what order do you treat these infections? So the answer is yes, I have been able to. And sometimes, when people have seen me, I tend to offer people both herbal and prescription options. And often some people that see me are they're herb only people. That's all they want to use. They don't want to do the prescriptions, which is fine. I think that from a Lyme standpoint, I think herbal antibiotics can work as well as prescription. I think they have as good a chance of helping you. When it comes to Babesia and Bartonella, I think the prescription options have a slightly better chance, maybe 5 to 10% better than the herbal options, but the herbals can still get you there. I have had people that are extremely sensitive, though, and my med sensitive people, I tend to go herbal antibiotics. And the thing that's nice about going herbal antibiotics on somebody that's med sensitive is you can do micro dosing. So as many of you know, for treating Bartonella, for instance, I like using a combination of cytokines and houttania, and then also sometimes using liposomal cinnamon, clove, oregano with that. I've had a patient of mine that had I was treated by another provider before she came to see me. And they overherxed her. She was so overcome with cytokines that she was debilitated for a very, very long time. And she had Lyme and Bartonella. And the best we were able to do, because she would just overly react, not as her cause, not that she was responsible for it, but this is what would happen. She would have it and she'd get these super strong reactions, mostly Herxheimer reactions. And so we wound up getting her well, doing, I think it was 1 drop twice a day of Otoba and Catskillow, and 1 drop twice a day of houttania and of cytokines. Okay. And as many of you know, to put that in context, I usually tend to dose those up to 30 drops twice a day, work up to that. So you can get well on low doses and based on what your body can handle. And yeah, I have had people do this all herbally, mold, Lyme, Bartonella, Babesia before. And then in terms of how I treat infections, I tend to, if all things being equal, if somebody's sick and I think all of the germs are contributing equally, I'm going to treat Lyme and Bartonella first together. And as we start getting Bartonella under control, then I'm going to add in Babesia, and I may still treat all 3 germs at the same time. The reason I do it that way is based on the observations of Burriscano. Not sure if you all know Burriscano. Burriscano was one of the pioneers of Lyme disease treatment. He taught many of us that treat Lyme, giving his pearls of wisdom, if you will. And he treated out on Long Island and had treated for years. His observation in his practice was that if he treated somebody that had Borrelia, Babesia, and Bartonella, and he chose to go for Babesia and Lyme before getting Bartonella under control, it made it more difficult to get rid of Bartonella. Okay, that was his observation. And so I've tended to build my treatments that way as well too. Okay, all right. Good luck to you. Thanks for the question. Hello, Lynn again. Let's see, I'm not sure if this is the same Lynn, but hello, Lynn. Hi, Dr. Ross. Do you have any thoughts about using neuroquants to assess and monitor neuroinflammation for things like Lyme and mold? Also, if chronic vaginal yeast infection is the main symptom of candida, can that be treated the same way you treat yeast that is in the gut, with herbal or prescription antifungals like Phytostan, Capri Plus, diflucan, or amphotericin? Let me read back here again. Oh, chronic vaginal yeast. Would something like biocidin drops, which you said stay mostly in the gut, be a good idea, or would it be better to use the biocidin LSF? Would any of these be safe to take the same time as probiotics, or should they all be spaced from probiotics? Okay. So in terms of doing neuroquant is a type of X-ray that looks at your brain mass, basically. And the person that has advocated doing that a lot is Richie Shoemaker, who is the person that first described mold toxicity. I haven't built my treatments around that. I haven't used that in terms of helping me assess where a patient is. I go more by what their symptoms are. So I can't comment as to whether it's useful or not. I know I get people well without relying on it at all. Okay. In terms of your vaginal yeast, there is a probability that if you have too many yeast in your vagina, you probably have too many in your intestines too. Okay, all right. But all the things that we use to treat intestinal yeast do not necessarily work their way into the vagina. And that main one that does not is amphotericin B. Anything else that you use to treat intestinal yeast is going to work its way into the vagina. It's going to get absorbed into the blood, and then through the bloodstream is going to leak back into the vagina and take care of it. Okay. So, of the biocidins, your best blood absorbed biocidin is the biocidin LSF. That's the liposomal formula. So liposomal means it's the biocidin chemical is microscopically wrapped in fat, which helps increase its absorption. Okay. And so that's going to get into the blood and therefore get back into the vagina easier than the biocidin drops that you mentioned. Okay. So in terms of, any of the recommendations, any of the antifungals that I recommend, you can use everything to ultimately treat vaginal, except amphotericin B is not going to do it. And your biocidin LSF is going to do a better job than the biocidin drops. Okay. In terms of your probiotics, the probiotics are okay to take with your herbal antifungals, except, you're probably going to be better off with your phytostan, your Capri Plus, and your biocidin, because those herbs also can lower some bacteria. Usually they're lowering the bad bacteria in your intestines, not the good stuff. And your probiotics should be full of good bacteria. But because there's a slight chance, I tend to separate those as well too. I try to make sure you're taking your probiotics at least 2 hours away from something that might kill them. Okay. All right. Good luck to you, Lynn. Thanks for your question. Hello, Jackie. Hi, Dr. Marty. I'm following the weed, seed, and feed protocol for a severe and chronic yeast infection, expecting to stay on this protocol for a good year or two after finishing amphotericin B. I'm also undergoing prophylactic breast surgery with reconstruction and expected to have 3 surgeries with strong antibiotics. How would you suggest I keep yeast under control during this time? Would Ampho B and the protocol be sufficient? Any advice greatly appreciated. Thank you. All right. So, bear with me. I'm trying to figure out how much to re-explain about weed, feed, and seed. And so everyone, weed, feed, and seed is an approach I use for managing people with chronic yeast infections, especially ones that have recurrent ones and have difficulty getting over them. And it's the concept of doing it is something I introduced maybe 4 weeks ago at one of the webinars. I even have an article on it. Okay. But essentially, weeding means taking something to kill your yeast. Feeding means being on good seeding means being on good probiotics to put healthy bacteria into your intestines to take over that territory to battle yeast. And then feeding means a couple things. One is to be on soluble fiber. Soluble fiber is a very good food source for your good bacteria in your intestines. There's various foods that are rich in soluble fiber, like avocados, Brussels sprouts, yams. There's pectin. Those are all things that are really good. You could also do a supplement called pectin powder that gives you soluble fiber. And the other thing about feeding, especially for people that have recurrent yeast infections that are hard to deal with, is to not feed your yeast. And I try to get very strict about being on a paleo type diet that's more plant forward with some animal proteins, obviously, but plants, but avoiding in your plant in that being paleo, you would actually stop doing try to not do beans, legumes, and grains. Okay. All right. And so I outline that in this article, and I'll show you all that article rather than go through everything about that. Okay. So that you can look at it. But Jackie, to answer your question, I probably, given if I remember correctly from your previous webinars, if you've got severe recurrent yeast infections that have been hard to get rid of, even on amphotericin, what I would do with a situation, somebody in a similar situation in my practice, I would probably leave them on amphotericin through the surgeries. Yeah, I would be trying to kill them down, and I would also be on probiotics. I would be doing all the food options that I mentioned. And often that is enough to keep things under control. I wouldn't add anything more to it. Okay. All right. So do a quick screen share here and show everyone that article. It's an article that I developed based on the webinar, what I said in the webinar. So hold on here just a minute. All right. So, okay. So let me see where I put that. Oh, here it is. So it's an article. It's called "How to Fix Recurring Treatment-Resistant Intestinal Yeast Overgrowth." Okay, and look through this. It outlines all those steps that I call a weed, feed, and seed approach. Okay, or weed, seed, feed approach. Okay, but I lay it out here in this article. Okay. All right. All right. Jackie, thanks for that question. Hello, Alex. Says, "Hi, Dr. Ross. In regards to yeast overgrowth, I've seen in previous webinars that you recommend 2 options for treatment. What is your recommendation for both prescription and herbal that you have seen works the best? Also, how many times a day do you take them? Do you usually start at a lower dosage level and slowly increase to avoid a cytokine storm?" Things. Okay. So, to answer your question, probably the strongest herbal options, I offer a number. I talk about using biocidin. I talk about using a product called Capri Plus. Capri Plus has in it caprylic acid, garlic, and rosemary oil. And there's another product called Phytostan that I work with by Integrative Therapeutics, and that has in it some powder coco, caprylic acid, thyme oil, rosemary, I believe, and some undulacinic acid. Okay. Of those 3 products, the one that I find strongest is the Capri Plus. And I have people take it as 2 pills twice a day. I generally don't build up to it. I rarely see severe Herx reactions on that. And when somebody is doing it, I say it's going to take about 2 to 3 months, and I give it about an 80% chance it will take care of the yeast. In addition to that, you want to be on probiotics, and at a minimum, limit simple sugar. So cookie, candy, cake, ice cream. Don't be using that kind of stuff. For just starting to treat yeast, I don't think you need to go totally restricted in terms of the carbs, like the beans, grains, and legumes that you have to restrict to somebody that keeps having recurrent problems. Okay, so it's just remove simple sugars, and that it means it's okay to do whole fruits, whole vegetables. I don't advise juicing. Juicing is straight sugar. You don't have any fiber attached to the sugar that comes from that fruit or that vegetable. But when you're having a whole fruit and a whole vegetable, fiber limits the amount of sugar that's available to the yeast to feed them, basically. Okay. And then in terms of the strongest prescription option, the one that has the greatest chance of working, it would be amphotericin. That has to be made by a compounding pharmacy. It's 200 milligrams 3 times a day. It takes about 2 weeks to work and works about 95% of the time. You still need to be doing probiotics with that as well, too. Okay. So to answer your question, you asked what are the best. That's what it is. I'm not reviewing all the other options. I will show you an article, those that want to look at the other options besides just the best. Okay. All right. So good luck to you, Alex. Let me do a quick screen share here again. All right, so I have a section in my online site, and also the same information you can find in the book too, is this section called Yeast. Here is my guide, which reviews various prescription and herbal options about treating yeast. It's called Kills and Prevents Yeast, a brief guide. Okay. All right. Thanks for that question, Alex. Hello, Colleen. Let's see. Hi, Dr. Ross. In addition to Lyme testing years ago, I'm trying to read this without, there we go. Now I can see it better here. Hi, Dr. Ross. In addition to Lyme, testing years ago showed mold in both me and my home. This year, I will finally have saved up enough money for mold remediation. This was to be the next step after an attempt at Lyme. and co-infection treatment with first pharmaceutical antibiotics, then herbal antibiotics. After a few hard herxes when trying to advance the herbs, I had just stuck at 3 drops of each of those 4 tinctures. Profound fatigue never resolved. I've been taking this for years thinking I am keeping Lyme and co-infections at bay until I address my mold issues. But I now wonder if I was misperceiving this and if continuing herbal antibiotics for that long isn't a good thing to do. Maybe it's okay since it's such a low dose. I tend to be sensitive. What's your opinion? Thank you for all the wisdom you share with all of us. I've learned so much listening to you each week. So, I can't say whether it's good or bad. I mean, it's all very individual, to be honest with you. Compared to being on prescription antibiotics, this is a lot less harmful. The major risk you have of doing herbal antibiotics is potentially altering some of the good bacteria in your gut, but compared to prescription antibiotics, the risk is quite small, or very, very small. So I can't say whether it's good or bad. Okay. What I will say is that if you've had mold toxicity and haven't dealt with it, that could look just like Lyme. Okay. So keep that in mind as you start dealing with that problem as well too. You may find remediating your home and using binders may get you well, and it might not have anything to do with whether you have Lyme and co-infections in you or not. That's possible. Okay. All right. Good luck to you, Colleen. Thanks for the question. Hello, Brandy. Hold on here just a minute. What infection could potentially cause a crackling, almost electrical feeling at the base of the skull ever since the weakened muscles and cranial instability? I've seen this exact same circumstance mentioned several dozen times in social media groups. Is it when the infection penetrates the spinal cord and maybe a temporary fluid leak? I feel like my motivation and vitality were immediately affected, like something hijacked the accelerator pedal, like I'm getting that autistic syphilitic 1,000-yard stare and I'm aware of it. The 2 infections I think of that give electrical neurologic type symptoms are Lyme and or Bartonella. Those are the 2 that I think of. Obviously, they would give many more symptoms than just that. So to tell you which one it might be, I would need to ask you a lot of questions to figure out whether I think there's Lyme or Bartonella here. But of the 2 of the tick-borne infections, those would be the 2 that I might think about. Okay. All right. Good luck to you, Brady. The reason I think about those 2 is they both give neurologic symptoms. Okay. They both infect the nervous system, basically. All right. Hello, Flavia. Say hi, Dr. Ross. Thank you for your time. You're welcome. My son, after started taking rifabutin, his white cell count dropped to 2.9. Normal range is 4.5 to 13. A lot of people says we just have to monitor his number every month. What do you suggest to get this numbers higher? I don't want to take him off this medicine since it's doing good on his bar symptoms. Thank you. So a number of antibiotics can suppress your white blood cells. So I treat a lot of people that during the course of their treatment, they may develop low white blood cells. And it's temporary. When you finally stop the antibiotics, it will reverse. It tends not to be a permanent thing. Okay. I like to keep my white blood cell counts at about 1.8 to 2 or higher. But at this level, you don't have any impaired ability to fight infections. And so I would agree with what other providers are telling you, which is just monitor it for now. Okay. All right. Good luck to you, Flavia. Good luck to your son. So I agree with what your doctors are saying. Okay. Hello, Doug. Let's see. Back in 2017, I tested positive for Bartonella henselae and never treated it correctly. Fast forward to now, I tested positive for Babesia microti moderate, which I was told is high, 17 to 1. So, Doug, I don't see a second part of your question. Hold on just a minute. Oh, here it is. Okay, so here's the full question. Let's see. Hello. I tested positive for Bartonella henselae, never treated correctly. Recently tested positive through Vibrant for Babesia microti at 17.1, which I was told is high. My concern is I have a lot of neuro issues. What are Babesia neuro symptoms, if any, and why wasn't I positive for Bart this time around? And can Babesia be neurologic? Headache, muscle joint pain, dizzy palm, stiff neck. Also, this is my Babesia protocol. What do you think? Turmeric, berberine, acid reducer, cryptolepis, oil of oregano, lumbar kinase, azithromycin, and atopiquone. Okay. So, first of all, the Vibrant Labs has validated and shown through studies where they've taken samples from people known to have Lyme, Borrelia, that they are good at detecting when Borrelia is present, and when you get a positive test that it really is real. Okay. So they've only validated adequately their Borrelia Lyme test. In my opinion, they have not adequately validated, proven to me through their testing on samples from humans known to have the illness and those not known to have the illness, that their test is appropriate when it's negative and appropriate when it's positive at determining what they say they determine. So I don't know what any of this means. Okay. I don't trust their lab basically because they haven't done the steps that are required of a lab, which they should be doing validation studies on samples from humans known to have an illness and those not known to have the illness, and see how good their test is at finding it when it's there and not wrongly identify it being there when it's not there. So, you know, the thing, so independent labs like Vibrant, Hygienics, Infectolab, all of these labs, whenever they offer a test, because they're independent labs, they don't have to be FDA approved. The reason you get FDA approval is if you're going to sell your test kit to somebody else to use in their lab system, then the FDA approves it to say that they follow certain quality steps to make sure that the test they put out is of adequate quality. And to get FDA approval, they have to do some testing to show that it's a valid test, all right? But when you're an independent lab, you don't have to prove to anyone to do the test that you have a valid test. But we as physicians, if we're going to use an independent lab, we should be getting on the telephone and calling them up and saying, share with me your validation studies to prove that your test works. And when it comes back positive, that it's right. And there's a number of labs that haven't done that kind of lab work. I will say Vibrant's done a good job with their Borrelia test, showing that it's accurate. They have not done adequate studies to say that their Bartonella and Babesia is accurate. Okay. All right. If you do have Babesia, a protocol that uses azithromycin and atopiquone and cryptolepis can be useful. It would be something I have used in my practice before. Okay. All right. Good luck to you, Doug. Hello, TJ. Let's see. Are there any unique or special treatments that you've used on any of your patients that have Ehlers-Danlos or Marfan syndrome? It seemed like there's an inordinate amount of people in those groups affected by Lyme disease. It almost appears like those syndromes aren't just connected tissue, but also immune system related because they have severe allergies. Is there anything we can do for what, or we just simply doom from genetics and a walking time bomb exacerbated by Lyme? Boy, that's a big question. So, Marfan's and Ehlers-Danlos, basically connective tissue is loose. Okay. And there's a genetic reason for that, but having Lyme might exacerbate that by leading to some connective tissue breakdown further. Okay. That's basically what I can say. Are you doomed? Not necessarily. But is this something I need to manage? Yeah. I mean, physical therapy can sometimes help. Getting your germs under control can help. But it's a difficult situation, to say the least. Okay. All right. Good luck to you, TJ. Oops. Christine, I was about ready to take your question about transitioning to herbal from prescription antibiotics, and I accidentally clicked the delete button. So I don't have it here now to post and read the whole thing. I apologize to you for that. All right. Hello, Alex. Are you seeing Lyme patients getting long COVID more than the regular population? Have you seen reactivation of Lyme, Babesia after a COVID infection? So I don't see in my practice that people with Lyme have a greater chance of getting COVID than anyone else does. And also in my practice, I don't see that people that have Lyme have more of a difficult outcome or manifestation of their COVID compared to the general population. And therefore, I am not seeing increased amounts of people getting long COVID that have Lyme disease compared to the general population. Okay, I don't see it as a risk factor. I have not seen anyone in my practice that was in remission with Lyme, Bartonella, or Babesia get a relapse after getting COVID. I'm not saying it doesn't happen. I just haven't seen that happen. Okay. All right. Good luck to you, Alex. Hello, Mary. Let's say hi, Dr. Ross. Thank you for taking my question. You're welcome. My Lyme physician prescribed Rocephin, clarithromycin, and atovaquone for Lyme, Babesia, and Bartonella. I'm going to stop the Rocephin, add Levaquin and liposomal cinnamon clove and oregano to try and focus more on the Bartonella while still treating Lyme and Bartonella. What do you think of the combination? Do you think that this is sufficient enough? Years ago, I was on Levaquin and I did not have any issues with tendons, and I thought it worked well. Thanks again. All right. So in terms of, the fluoroquinolones would be things like Cipro and Levaquin. They can be effective against Bartonella. I tend to not use them in my practice because I've had an occasion of people having ruptured tendons or develop some ongoing tendonitis. And I think that there are other options that can work just as well. And so I tend not to do it. Now, I don't know that you won't develop a problem because you didn't have a problem before. I would be comforted by the fact that you didn't have problems developing tendonitis or ruptured tendons before on Levaquin. I don't know that that means you won't in the future. Okay. I'm comforted by it though. But I'm not sure. But, in terms of, would this be a good killing regimen? Yeah. So the combination of your Levaquin, clarithromycin, and your cinnamon clove oregano would be a very good regimen at treating Bartonella. One thing your provider probably is aware of is that both the clarithromycin and the Levaquin can alter something called the QT interval in your heart rhythm. And it's a part of the electrical conduction pattern. And if you get QT interval prolongation, especially if people are more in their 50s and above, it sometimes can lead to a heart rhythm problem. So one thing that if you are 50 or older that I like to do in my practice is once I have people on those medications, I like to get an EKG to make sure that they're not developing a problem with that QT interval prolongation. Okay. All right. And those are some thoughts. But to answer your question, would this be a good treatment in terms of effectiveness? Yeah, it could be. Whether it's a safe thing to do, I'm not sure. Okay. All right. Good luck to you, Mary. Hello, Flavia. Let's see. Hi. I heard binder can't be taken with Lyme treatment. Is it true? I heard we just need to take binders apart of everything and it should be fine. Can you be clear how to use binder on Lyme, Babesia, and part treatment? So I treat people for their Lyme and co-infections along with mold toxicity simultaneously. All right. Now, having said that, there are some situations where based on the history, if it's pretty obvious to me that the person, although they test for Lyme, they're positive, and that basically the history says they didn't get sick until they got their mold exposure, I might go after mold toxicity by itself first. And because in some people, it's the mold toxicity that gives you all the symptoms. It's not Lyme. Our immune systems can deal with Lyme and co-infections sometimes. Okay. So for instance, there's a person that came to see me years ago that had positive Lyme testing, severe neurologic symptoms, had lost his job, had lost his wife, his kids couldn't come see him anymore. He extremely fatigued and had Lyme testing and was told by a naturopathic doctor up in Seattle that he should immediately jump on a plane and fly out to get IV antibiotics from GemSec out in Washington, D.C. And I looked at him, and his mom brought him in. She's a nurse, and she said, "I want another opinion." And so he's like in his mid 30s, and he was pretty bad off. But the thing I asked him, I said, "So tell me more about where you were when this happened. When did you first start getting sick?" And as I delved into the story, I learned he'd been doing good in his health until he moved into a house that had an aquarium in the back bedroom, and there had been some water damage back there. And we eventually learned that there was mold toxicity back there, or there was mold back there. And so I said, if you were doing well until you moved into this house with mold, probably your problem is just mold toxicity. And I know you test positive for Lyme, and I know Lyme can give you all these symptoms, but that doesn't mean it's Lyme. It could be something else giving you these symptoms, and mold toxicity could do it. And so all we just did binders for 6 months, and he was 100% well. Got his job back, got his life back, and we never dealt with the Lyme because I think his immune system had dealt with it. Okay, so if there's a situation where I am very, very clear at the beginning of treatment that the story says it's the mold toxicity that made them sick, even if somebody tests positive for Lyme, even if somebody had a tick attached, but if the history tells me it's mold toxicity, I'm going to just treat for mold toxicity and not put people on antibiotics for tick-borne infections. Okay. But if it's not clear to me, I'm going to treat for both at the same time. And you can treat both at the same time. Basically, you have to separate your binders from when you take your antibiotics and your other medicines. And I tell people, take your binders once or twice a day, usually at least once a day. And you need to make sure that you stop all medicines and supplements beginning half an hour before you take the binder. And then you need to stay off all your medicines and supplements through 2 hours after you take the binder. So there's a 2.5 hour window where you can't take other stuff. All right. But you can easily set your alarm clock to remind you when it's time to take your other medicines you're taking for Lyme or Bartonella. And so, yeah, you can do them. I do that all the time with my patients. Okay. All right. Good luck to you, Flavia. Hello, Sarah. Let's see here. Hi, Dr. Ross. Thank you for all you do. You're welcome. Do you ever see POTS dysautonomia in your patients? I was exposed to mold many years ago, detoured, moved, got rid of belongings, etc., but never recovered. Trying to figure out if I should look for the root causes of this, or is it permanent damage? Lyme test from IGeneX was negative, but Bartonella from LabCorp was positive for IgG, but negative for IgM. Thank you. So yes, a cause of POTS can be mold toxicity. POTS can be caused by Babesia. POTS can be triggered by Lyme and by Bartonella. I do see that in my practice. And it is true, if you have POTS, there probably is some underlying issue, whether it's a mold toxicity, a Borrelia, Bartonella, Babesia. Those would be things I would be looking for, especially Babesia. Keep in mind, if your testing was previously LabCorp is not strong on Lyme, strong on Babesia, strong on Bartonella. To get better answers from a testing standpoint, at least, these days I would do the immunoblot process that's offered by IGeneX for both Lyme, which is Borrelia, Bartonella, and Babesia. That immunoblot basically is looking to see, for Lyme, they're testing to see if you have antibodies that attach to Lyme proteins for 8 kinds of Lyme. For Bartonella and Babesia, they're looking to see if you have antibodies that attach to proteins to the family of Bartonella, which includes 15 strains, and the family of Bartonella, which includes 15 strains, and the family of Babesia, which includes maybe 15 to 20 strains. Okay, so if your Babesia family test comes back positive, that means you got some kind of Babesia going on. All right. And on the Bartonella side, in addition to testing for the family, they test to see if you have one of 4 different strains like Bartonella henselae. And for Babesia, they test for Babesia microti and Babesia. I'm blanking. We used to call it the WA1 strain. I'm just blanking right now. But anyhow, they test for at least 2 strains, and then they test for the family. Okay. Now, the other thing that they do with this immunoblot method is they decrease your chances of having a false positive, because they use genetically modified proteins from these germs, and they remove pieces of those proteins that might wrongly hold on to antibodies that were made against other infections that could give you a false positive test. Okay. So it's a good test. The sensitivity on these, the ability to find infections of the various immunoblots that they offer, are going to be about 90 to 95%. That's pretty good. And your specificity, the fact that when you find it, it's really right, is about going to be around 100% on those. Okay, so that's good. All right. Thanks for our question, Sarah. Hello, Diane. Let's see. How is cardio-Lyme diagnosed? How is it treated? So basically, if you have cardiac issues like electrical conduction problems, that might show up on an EKG. If you have inflammation of the heart lining or the heart muscle, that's also going to show up on an EKG. You're going to be certain changes that you're going to see. Okay. And if you happen to have Lyme with that, then they might say it's Lyme giving you those causes. Okay. That's mainly how you're going to wind up doing it. If your heart stops pumping strong enough, sometimes they might need to get an echo to make sure that you're not developing congestive heart failure. They might get a cardiac echo as well to make sure that you don't have loose valves that are causing some of the heart skipping around that you might get as well too. Okay. The other testing that might be done is a 24-hour or longer Holter monitor, where you wear wires attached to your chest that measures the electrical activity of the heart, and they do that over a 24-hour to 72-hour period of time too. Okay. All right. Thanks for the question, Diane. The thing I want you to know, if you have problems, there isn't a test that proves that Lyme caused it. It's just that if you have Lyme and you have one of those problems, there may be a probability you have a Lyme carditis. And the treatment would be to treat the same way you do non-Lyme carditis, although sometimes people are going to tend to go more with injectable rather than oral antibiotics to treat it. Okay. All right. There we go. Hi, Sandra. Let's see. I have confirmed Bart, Babs, and Lyme for my Genix. I have air hunger while at rest and itchy spots with blisters, occasional neck pain, and frontal headaches. Which would you attack first with herbals, Bart or Babesia? Yeah, you've tried to tell me what's going on with you, but I can't tell. I need to ask you a lot more questions than obviously I can do in this kind of a format. So I can't tell you for sure. Okay. All right. Good luck to you, Sandra. Hello, Margaret Lee. Let's see here. My daughter has Bart, Lyme, Babesia, and is on a comprehensive protocol of pharmaceuticals and herbal antibiotics, many supplements. She flared after getting COVID, was put on Celebrex for this, which seems to be helping a lot. Why are NSAIDs uncommonly used in treatment? Is it because of the risk of peptic ulcer disease? Was told Celebrex was less harsh on the stomach. She was already taking natural anti-inflammatory supplements, curcumin, sulforaphane, glutathione, NAC, ALA, but never not helping. Should she try to stop Celebrex as soon as possible? 2, about COVID flares. How are you managing them in your patients? Do you have an opinion about Bruce Patterson's long COVID-14 cytokine panel and treatment using ivermectin, statins, and Miraviric? All right. So generally, the reason most of us don't use Celebrex is not necessarily good for cytokine inflammation. Okay. And the majority of people with infections, the inflammation they're getting is going to be cytokine related versus Celebrex does not target those kind of inflammatory chemicals as well. Obviously, your daughter seems to have a component of non-cytokine inflammation too. Okay. So that tends to be why we tend not to use them. And yeah, with all of the NSAIDs, there are risks of GI complications. And so we tend to avoid them if we can. Okay. All right. And then in terms of COVID flares, I think so. I am aware of Dr. Patterson's work. And what I have seen is maybe 30 to 40% of people are getting some benefit out of his work. So I think for a sector of people with long COVID, that his approach may be useful. I think that long COVID is many different things. It is not all due to persistent spike protein, as Dr. Patterson would suggest, or even persistent infection. There's many other possibilities of what it can be. But for those people that have persistent spike protein or persistent infection, there is a possibility the Patterson protocol may make a difference, okay? Even when you have the cytokine panel that he does showing the possibility of long COVID, I find it's maybe 40 or 50% useful to do his Miraviric and the statin protocol that he uses, okay? The difficulty with Dr. Patterson's work is he's the only one that's done it. In other words, he's the only one that studied his approach. And the problem you run into with people being the only people that study the thing they do is their interpretation of the data and their conducting of the experiments are strongly biased in favor of what they believe, not necessarily what the truth is, okay? And to date, I haven't seen that anyone has replicated his studies or tried to replicate them and then had similar results. Okay. So I think the jury's still out on his. And I think that what is long COVID is many different things and is unique in what the cause is to each person, actually. Okay. Good luck to you, Margaret, or Margaret Lee, I should say. And good luck to your daughter. Hello, Nadine. Let's see. My niece has been diagnosed with Lyme disease. She lives in France and have been trying to get better for over a year. Doctors are giving her a lot of antibiotics. And let's see here. Let's see. I'm following the parts here. She would like to have a referral for a doctor in France, Switzerland, or Germany. She heard Germany has good treatments for it. Do you have a referral? Oh, okay, I get it. I don't have one at this point. I'm sorry. The person I might have referred to is no longer practicing there. He's up in the UK. And I'm not even sure if he's got, if he's just doing online presence or whether he's got an active practice up there or not. You might reach out to ilads.org. And so that group is called the International Lyme and Associated Disease Society. It does have members in Europe as well as the United States. It tends to be United States heavy in terms of its membership, but they have on their contact page, you can write to them and request the names of providers in these different areas and see what they come up with. But I can't tell you off the top of my head who's there. I don't know. All right. Good luck to your daughter. Or your niece, I'm sorry. Bear with me, everyone. I'm just cleaning out the parts of that question there. Hello, Stephen. Let's see. What protocols do you recommend to regrow nerve damage after getting Bartonella under control? Specific peptides, injectable B12 shots, vitamin D. So what I like doing to repair nerve injury is glutathione, which is a very powerful antioxidant made in every cell, can help repair damage from the inside. I like to have people take 1 teaspoon once or twice a day of the product called Trifortify, which is a good liposomal glutathione product that has really good absorption. Okay, that's made by Research Nutritionals. I like to do mitochondria and nerve cell membrane repair work, doing phospholipid repair, using the ATP 360 that I talked about earlier tonight, 3 pills, 1 time a day. And I'll do that for maybe about 2 months and see if we're making any progress. If not substantial progress, then I would add in the oral peptide. At least this is what I do in my practice. I would add an oral peptide in called BPC 157. Peptides, as many of you know, are agents that our bodies make naturally on their own. And there is this one that is made in the stomach lining called BPC 157 that we have found to be very useful at doing tissue repair, whether it's nerve, muscle, tendon, etc. All right, it can really support tissue repair, and I've had good results using it for that. And then, in addition, it helps support mitochondria function as well too, balances the immune system, may even treat for some mast cell activation as well too. And that I start people at 500 micrograms, 1 pill twice a day. And I give that a go for about a month or so. And if it doesn't seem to be going good enough, then I might do 2 pills twice a day on that. Okay. And I do that all at the same time that I still have them still on the ATP 360 and on the glutathione. And then in terms of, I do B12 only if somebody has low B12. I do vitamin D only if somebody has low vitamin D. Okay. All right. So those are some thoughts there for you too. Okay. Now, these are ideas I'm giving you, but again, I'm not your doctor. And so I urge you to talk this over with a physician who has a relationship with you. I'm talking about things I would do in my practice on my patients. All right. Okay. Good luck to you, Stephen. Hello, Sarah. Let's see. I should add my mold doctor does not think I'm still being exposed to mold, does not think I have POTS, and is unwilling to help me further. I'm taking Mestion and Midodrine and feel significantly better. Got it. Yeah, Sarah, so to answer your question, so you are on some medications for POTS. Your doctor doesn't think you have mold toxicity anymore. I would still go back and retest and look at whether there is a possibility of Lyme, Babesia, or Bartonella. I don't think the testing that you told us about earlier is adequate to see if you have Bartonella or Babesia. Okay. All right. Good luck to you. Doug says BART treatment won't work until you get rid of Babesia. That's not true. In my practice, I get rid of BART well before I get rid of Babesia. As I said, my preferred order is to do BART before Babesia while I treat Lyme at the same time, Borrelia at the same time. Okay. Good luck to you. Hello, Caroline. Let's see. Thank you, Dr. Ross, for these sessions. How do we know if we have cleared those infections after months of treatment? Are there repeat blood tests following treatment? That's the question. You will find doctors that want to go retest you, repeat the Western blot, immunoblot, or the ELISpot to see if the germ is still there. But the truth is, we do not have any testing that proves whether the germ is in you or out of you. We do so the ELISpot T cell activation test and the immunoblot are both ways of seeing how your immune system is responding, but they're not tests that actually look at germ load. Right. So if your immune system stops responding to a germ, it could be for a few reasons. It may not be responding to that germ because it's being suppressed by an active germ. All right. It could be that the germ is hiding in the body in a way that it cannot be seen by your immune system as well too. All right. An alternative is you could have low levels or a no immune response because the germ is gone, but we have no way of knowing. All right. So a negative immunoblot or a negative T cell activation ELISpot does not prove the germ is gone. It could be all immune suppression, or it could be that the germ is gone and they're negative for that reason too, but we have no way of interpreting that to know. So I gauge my symptoms and I look and see. My goal of stopping treatment is I treat until somebody's 100% well for at least 2 months before I stop, because I find less chance of getting into relapse situations that way. The other thing I will do is, because some people you can't get 100% well, I will treat until somebody is at a plateau for 4 months. And no matter what I do to move them forward, nothing seems to move them forward. Then sometimes I'll say I'm done then too. Okay. But usually that's with having treated for a year or two, because that's data tells us that's how long it takes. It's about that long. Okay. That data I'm referring to is a group called My Lyme Data that is part of LymeDisease.org. Has a database of about 16,000 people enrolled now. We have 16,000. And they periodically query them to find out various questions. A few years ago, they asked them, what did it take to get you well? And the response basically was 3 things. Number 1, working with a Lyme literate physician that knew how to navigate through things. Number 2, being on antibiotics. And number 3 was treating for a year or more. Okay. That's what the data tells us. Okay. All right. Good luck to you, Caroline. Ooh, excuse me, everyone. All right, that's it. I've had a good time being with you here tonight, and look forward to seeing you again next week. Next week, I will be back in my Seattle office, so we won't have the wallpaper with framed animal in human clothes back there again. But I will be back here in probably 3 weeks. We'll be doing it from here. So anyhow, good being with you here tonight. Take a look at your email tomorrow morning. You'll have an email notification from me that the webinar recording is ready to be viewed. And in that email will also be a link for you to sign up for next week's webinar as well too. If you like what we're doing here and you're getting good results out of it, keep in mind other people will too. So share, send those emails that I send to you to other people. And I'm trying to help as many people as possible. All right. So help me do that. I appreciate that. Good night, everyone. Good being with you here tonight, and good luck on your journey. All right. Bye-bye.